Good evening, and welcome to Channel 7 British Global News. Tonight, we are going to share with you a special report about the British healthcare system from the perspective of an American and a London native. We will also be shedding some light on the United States government shutdown, how it started and how it will affect England.
Meet Courtney Edton, an American who visited a London clinic on Tuesday the 22nd and got a better view of the British healthcare system.
Since my arrival in London, I've had this cold that I just could not kick. It seemed to be getting worse and I feared sinus infection. So I eventually went to the Soho NHS walk-in medical clinic. The clinic was exactly how you would imagine a clinic to look. You walk into a large waiting room of sick people and a line, or queue, as you call them here in the UK, along the back wall leading up to the reception desk.
All residents of England receive healthcare coverage from the National Health Service, the NHS, a government-run service. The NHS covers preventative services including physician visits, screenings, immunizations, vaccinations, and in- and outpatient care. Some things that are not covered by the NHS include prescription drugs.
I ended up spending £7.65 for a Milsim that the doctor ended up giving me. Almost nothing compared to the American drugs. And even if you're not covered up by the NHS, emergency services and some infectious disease treatments are free.
Financially, the system is more cost-efficient than the US healthcare system. In 2010, England spent 9.6% of their gross domestic product on healthcare, while the US spent a whopping 15.2% in the year prior. Today, the US spends closer to 18% of our GDP on healthcare.
From a patient's point of view, not a taxpayer's point of view, I thought the system was great. In America, when I went in for a cough and the physician offered to give me an antibiotic, which is ridiculous because a virus causes the common cold, therefore an antibiotic would be completely useless. American doctors just want to give you a pill, send you on your way, even if it doesn't help. It's different in England. The doctor physically gives you the medication so you do not need to go to a pharmacy. My nurse also explained what medications and foods I should be cautious of when taking this antibiotic. Another thing American doctors are not very good at doing. She even gave me some home remedies of how to limit my coughing so I'd get better. One time, my doctor in America prescribed me steroids for a cough I had, and after taking them, I still had to cough. She never mentioned anything that the English doctor had mentioned.
Thank you for your interview, Courtney. Now back to you, Hermione.
Now, let's introduce our London native Emily Dixon and get her statement.
Currently in America, individuals must pay for their insurance through a health maintenance organization, but that is very costly and not everyone has the financial ability to do so. In the past few years, the U.S. passed the Affordable Care Act, or Obamacare, in an attempt to ensure every American will receive quality health insurance through a private insurance company. This has caused some controversy within their governments and is also one of the big factors resulting in the government shutdown. Even though this is a law, a minority group within the Republican Party, the Tea Party, refuses to accept this compromise. What are your opinions?
I honestly believe that Obama is on the right track towards guaranteeing universal health care in America. But I find it absurd that individuals must pay for their insurance through private companies. The government should be responsible for its citizens. The lives of people should not be in the hands of companies who are in it for the profit. The fact that this has resulted in a government shutdown is completely absurd. In Britain, we as citizens know our rights and we will fight for them. America should face its problems instead of delaying them.
Thank you, Emily, for that insightful information. Now back to you in the studio.
Now, on to the last portion of tonight's special program, the big question that everyone has been waiting for. How is the government shutdown going to affect Britain? Let's move to our newsroom with our 3 analyses.
Thank you for joining us today. Please share with us your opinions on the US government shutdown and how it will affect Britain.
The most direct impact does not lay with us. It most directly affects the 800,000 federal workers at agencies as diverse as NASA and the U.S. Treasury, whom have been furloughed, in other words, sent home without pay. Because Britain does not hold immense shares with the U.S., we are not as impacted as, say, China, for example. China is the #1 holder of U.S. debt, totaling $1,149 billion. Britain falls towards the bottom of the list, holding U.S. debt at $140 billion. Bonds bought in the UK, mainly by private investors and pension funds, make it the 8th country on the list at $149.9 billion, up to 13.5% on January 2009 when Obama took over.
I do not know how immensely this will affect our country, nor how long the shutdown will last, but Britain does not have much to worry about. Let's just hope for the sake of other countries and America itself, this problem will be resolved very soon, hopefully.
Thank you for joining us today on Channel 7 British Global News. This concludes our special program for tonight. As we say here in England,
Toodaloo! Good night!
Our 3 analyses. We will discuss the situation.